morning, everyone. You are tuning into Active Citizenship Foundation's webinar series on life after the pandemic facing the new normal. Today, our topic is on fighting political and health disinformation amidst the COVID-19 crisis. So in the middle of the pandemic, we've also seen an outbreak of disinformation. And it appears that this information is more viral than the health updates from our institutions. The most outrageous claims that I've personally heard went from the virus is caused by 5G towers, or that there is a miracle pill that would kill the virus in lieu of the vaccine. And we're surprised that it doesn't just, come from shady forum sites or group chats, that sometimes it's mounted by our politicians. So the outbreak of disinformation didn't just stay on cell phone screens amidst this pandemic. It also caused people to take, I guess, harmful actions. Like, for example, people taking injections of an unaccredited drug, such as what we saw in Zambales a few months ago. But moving on to the political, where the saturation of social media throughout the lockdown has been used by political operators to go against their political opponents, to weaponize the space for social media, not only to silence dissent or to stifle criticisms, but also to harass people with different opinions, or people who want to expose and show the truth. And we are seeing how disinformation, especially amidst a pandemic, can be very harmful, not just to our health, but to democracy at large. So this morning, we have our panelists to help us navigate through this whole discussion and debate on political and health disinformation. We have Dr. John Robert Bautista, a Bullard Research Fellow from the University of Texas in Austin, University of Texas, Austin, and we also have Miss Gemma Mendoza, the Head of Research, Partnerships, and Strategy of Rappler.
So good morning. So I think one of the crucial things that we need to understand first is that is there a difference between misinformation and disinformation? Based on literature, misinformation is false information that is spread regardless of whether there is intent to mislead. So it means that misinformation can be intentional or non-intentional. So we don't really know whether there is intent or not. However, for disinformation, it is usually deliberate, misleading, biased information. It's often manipulated. And some of the literature would tell that disinformation is in fact propaganda. So from the word itself, disinformation, the key word there is what we would say deliberate. But if you look at literature about health, they're more focused not on finding who are the perpetrators of the misleading information, but they're more interested with the particular effects onto the health of people. So it's not really that much on the health disinformation, but when you try to search for scientific studies, it's more of health misinformation, which is based from the Journal of American Medical Association, is a health-related claim of fact that is currently false due to a lack of scientific evidence. So we're focused here on health misinformation, and to just give a summary of what is health misinformation in COVID-19, here are some of the list of what we say are some of the list of misinformation, okay, that you can find about COVID-19. So first thing is that 5G mobile networks are causing the spread of COVID-19. Coronavirus stays in you for life. Then some people thought that it has the same mechanism as dengue. So mosquitoes spread coronavirus. And there's this thought about COVID at the earlier parts of the pandemic that it only affects old people, which is entirely false. So it affects both young and old. In terms of the symptoms, it's like some people say that COVID-19 is just like a flu, which is not that really exactly to be true. And there's this saying, there's this misleading post that if you can hold your breath for 10 seconds without difficulty, you do not have COVID-19. We also have heard about that vaccine is already available and that the governments around the world are just keeping it out of the public. So some sort of a conspiracy theory. And I've heard in the Philippines that there's some people that have taken alcohol that thinks that alcohol can cure COVID-19. There's some people in Iran who actually died because they consumed methanol, which is a derivative of alcohol, which is highly toxic. Next is taking chloroquine. And recently, we've heard news that people have been somewhat thinking that dexamethasone can cure COVID-19, which is they don't really have that much scientific basis. Dexamethasone is mostly effective for the management of those with severe cases of COVID-19, but it shouldn't be taken as like a preventive drug. Next, exposing yourself to the sun or to temperatures higher than 25 degrees and eating garlic prevents COVID-19 infection. So there are lots of misinformation circulating about COVID-19. And how do we authenticate those things? We authenticate those things by either being incidental. It means that you stumbled upon a news by other media. It can also be interpersonal, incidental. It means that you see more of your friends social sharing the news. So you somewhat authenticate news based on that. But we would like more people to actually make it more intentional, which is they actually cross-match information on their own. First, you can search on Google, verifying them with mainstream sites. You can also ask your friends, family members, or even experts on Twitter. You can actually ask them directly for some of your questions. So we want more people to actually become more proactive in terms of verifying health information rather than being incidental in terms of being just passive. How would you look for information? I would say that there are ways to look for information. You can search from international, national, or local sources. So I would say that the international would be the best, would be the World Health Organization. At the national level, you need to be in tune with the updates of the Department of Health. And for local information, it would be best to actually tune like social media pages of local or provincial units. For the World Health Organization, you can actually search for Google, WHO COVID-19 Mythbusters. They actually give you some infographics on what is true or not, what is misleading or not. So you can actually download them and you can use them to actually explain to other people, or if you want to correct someone. So these are already prepared graphics that which you can use. The only limitation is they're in English. Next is that I would urge people to actually, if you have Viber, most Filipinos will have Viber. Install the DOHPH COVID-19 Viber page, wherein that's where they actually post all of the updates. It takes about 10 minutes. They post it, then suddenly it will become part of the news. So it's actually good that people would actually subscribe to this DOH page COVID-19. So what does it contain? It would contain some details about the coronavirus, but it also contain details about like fact check. They have this segment about fact check, and they recently had this survivors pick as a way of increasing feel good information about COVID-19. So it's actually good to have this Viber page. So this is something that I actually almost look every day. So you will be updated. Next is that it's also good to be aware of your immediate location. Taga Mandaluyong po ako, so I usually tune into the Mandaluyong City Public Information Office. So most LGUs, local government units, or even the provincial government units, or even the local government units in provinces, they would have this Facebook pages wherein you can actually get news that is local based on your location. So sometimes the information from WHO is so at the international level, and DOH is usually much more on the national level. So it would be good for people to have information that they would be able to cross-match based on locally found information, which is, I would say, like those from the local government units or the provincial government units. One of the ways that we can help with this pandemic is become a digital frontliner. So recently, the United Nations started this verified web page. So you can Google search share verified UN. And this page wherein you can actually get information that's verified that you can share to people. So they want people to become digital frontliners. So we know the term frontliners, which is they're the ones who are making the economy and our healthcare system working even amidst this pandemic. But we can also help them by becoming a digital frontliner. So the verified would give us different information that can be shared, and you as a digital frontliner, you would be asked to share it to your social media networks. Also is that you can also lend your time to be part of the Fight COVID-19 Volunteers PH, which their main task is usually to translate information like from the DOH from different languages all over the Philippines. Mostly the DOH releases information in Tagalog and English. So this Facebook group actually processes them to be translated into different languages. They would actually have some sort of procedures. As someone who is interested with fighting fake news or help misinformation, you actually join this so that you can actually have this kind of information. I would say that one of the best practices to fight health misinformation is to first, once you see them, you immediately report them. The good thing with reporting misleading posts is that it's anonymous. So the first thing that we need to actually do is to empower people to report misleading posts. Next is to disseminate fact from trusted sources. We need to disseminate more fact because that's the way for us to drown health misinformation. Health misinformation is so fast and so big, can spread so fast, and usually it's being shared by lots of people. But we also need to reverse the process. We need more people to share more information and for more people to share accurate information in a short period of time. And to a certain extent, we can actually do social correction. We can actually pinpoint people, tell them that what you're sharing is incorrect. And I would say that based on Claire Wardell's 5 best practices, first, avoid ridicule or derogatory comments. Huwag niyo sabihin na bobo, tanga, o ganon. There's no point doing that. Next is focus on the facts. So you need to say whether that's true or false and make your content easy to process. So as much as possible, provide links. Be precise with your language, such as if it's in, wag yun na siyang Englishin kung medyo nahihirapan, kahit Tagalogin na lang, okay lang yun. You need to adjust the language based on the audience. And you also need to do some follow-up, like answer any questions that the correction might arise. Finally, I would say that in the long term, what are some of the things that I think that so that there will be less people who would be misled by health misinformation is that we need to properly implement policies to reduce the effects of health misinformation. And I would say that we need to intensify media information and health literacy education and training on the basis of RA 123, which is the Universal Healthcare Law, and for RA 10533, which is the Enhanced Basic Education Act of 2013. It's been used as a basis for the creation of media and information literacy in senior high school education. But I think within the literacy education program, we need to combine these 3, I think, so that any health crisis that we have, it's all intertwined. The media, the information, and health literacy, all of those forms of literacy will be useful. So that I would say that that is the vaccine against health misinformation. And it would be good that probably it might be difficult for this generation to resolve this, but we hope that in the future generations, they'll be well educated enough so that they won't fall with health misinformation regardless of what health condition it is. I think that is the end of my...
Thank you very much, Doc Robert, for sharing about different situations of health disinformation, how we can fight it by becoming digital of people. At the same time, the different tips that we can personally do in fighting health misinformation. So thank you for that. Maybe before we proceed with our next speaker, I have questions specific to health disinformation. In the onset of the pandemic, we've received a lot of infographics, for example, sharing about health tips on keeping yourself safe from the virus. And one example is that staying out in the sun for 3 minutes would kill the virus. I received that from my grandparents, for example. I'm receiving it from messenger groups, and then these come in social media cards that bear the logos of the WHO or sometimes the United Nations or DOH. How do we make light of that? Why do people create health misinformation that elaborate and that gets shared so much? Like, what are the causes?
Based on literature on misinformation and fake news literature, there is what we call the concept of social gift. So news sharing is a concept of social gift. So there are well-meaning individuals that they don't really intend to cause harm. It's just that when they hear something that they thought that's beneficial, like a news which says that that would lead you to become less susceptible to COVID-19, they would actually sharing it without much thinking about it because they think that news, that information is a social gift and it would increase your interrelationship with them. So that is for well-meaning individuals. And one way to actually correct them is to just explain to them that even though there are logos for DOH, they can be manipulated. There's this instance with UNICEF that there's health tips wasn't actually true, and WHO and the US problem. And you need to get your information directly from the WHO or DOH or UNT or tampering or editing some of these images that would involve impersonation. Actually, that misinformation about the temperature, it's also one of the parts of the COVID-19 mythbusters wherein it's not actually true that if you actually expose yourself to the sun, you wouldn't have the COVID-19. I think what's very important for Filipinos is that we have a very strong sense of social. We look at news sharing as a form of a social gift because we have a very strong communal relationship with people. And sometimes it's actually for us, those who have background on this, to actually tell people that we need to think twice before sharing it. We do appreciate their concern, but we really need to quadruple check. So sometimes double checking and triple checking wouldn't work. Think twice before you, I would say think 4 times before you share. Sometimes our grandparents, they didn't, their life, they didn't live in the world wherein much information or technology. So we need to help them to somewhat make them realize that there is some phenomenon like this and they need to be a bit more careful. I think those are things that can be done in a relatively respectful and gentle way.
That's true. I mean, my anecdote was that I approached my grandma, for example. She's based in Canada now, so I can't tell her or call her directly, but I explained to her that the World Health Organization already came out with a statement that it didn't come from them. And she was nice about it. Miss Gemma, did you want to add to that?
Yeah, actually, cause my own mother and my mother-in-law, ganun din, like they're not used to digital. The tendency for that is that if you see something that seems beneficial nga, share mo because yeah, baka makatulong sa mga apo ko, 'di ba? So for those kinds of misinformation, like yung parang hindi naman talaga sinasadya, parang well-meaning naman talaga yung tao. It's good to just, what I do is actually I message them. Mali po yan and ito po yung totoo. In a very respectful way rather than than like calling them out. But
yes.
Yeah.
It's a very interesting concept, this social gift. It's the first time I've heard about it. My relative came from a place of concern and didn't intend to to harm or to discredit DOH or World Health Organization. My second question, while we're on the topic of health misinformation, is also I received those now debunked social media cards from Messenger, and it appears that they are widely shared. Are health institutions also equipped with knowing what channels or what methods would make the correct information go viral in order to catch up with inaccurate content? What can you say, Dr. Robert?
There's this study on the journal Science which says that fake news or misleading information spreads 10 times, 100 times faster, and it spreads to 1,000 more people. So it's really, we need to acknowledge that we couldn't eliminate misinformation. Even olden times, it's quite difficult to do that, especially with the internet and social media. What we only can do is to actually mitigate it, which to actually make people aware that this kind of phenomenon exists, and that's why they need to verify information. So in the Philippines, the problem is that health system is already burdened by lack of hospital beds and power. We do not have the budget to actually create a task force about misinformation. And besides, on the literature of misinformation, very few are interested with actually finding the cause of this misinformation because they're already burdened with problems on how do we prevent people from having health problems because of that misinformation, to the point that we don't have much time to identify who these people are. And besides, health misinformation is quite different from political disinformation in that research would tell that health misinformation is easier to correct than political disinformation. In political disinformation, we don't really know what's true. So sometimes things are so fast changing, at least in health misinformation. In the context of health, there's this science to back up things. But sometimes for political disinformation, it might be difficult because people can get polarized in terms of their belief. And there are lots more factors that would make things a bit difficult for people to engage in dialogue, in constructive dialogue, I would say.
Thank you, Dr. Robert. One of our participants from the provincial government of Dinagat wants to share their initiative. They have an anti-fake news hotline directly connected to their public information office where people can ask to verify info. And that's, I think, a very important feat for local government to do, a direct access. The moment that they see a social media card on Messenger, Viber, or WhatsApp, they can call directly some local health experts.
Yeah, it's actually good that LGU would have this public information office that would actually help their constituents verify information, because sometimes gossips spread so fast. Sometimes it can destroy relationships with people. I've heard instances wherein one neighbor had this COVID-19. It wasn't really true, but people thought that that neighbor has a COVID-19 and people wouldn't want to actually go past that street to that neighbor. Sometimes it fuels discrimination in terms of those with or without COVID-19, especially for healthcare workers. There have been some instances that they were being badly treated because they say that even though they're frontliners, there's this risk of exposure to them, so they might be vehicle for the spread of infection, which is somewhat fortunate. So being hailed a frontliner and being also discriminated at the same time, it's not good. With what's happening right now.
And I think that really comes from a misunderstanding of how the virus is transmitted, or the different maybe protocols that health workers go through in order to protect themselves, as to why a lot of them are being discriminated. Miss Gemma, would you like to add to catch up with all of these widely shared disinformation?
I think so it's one thing to circulate the correct information, but I think the problem here, so one thing to understand here is this: the difference between you can look at the digital world as like something that allows the replication of content in a very fast way. So this is really why it's so hard to stop something from happening, from being circulated. In the olden times, we have this concept of chismis, diba? Chismis is like, it's not coming from one source, like unlike a broadcast source where you have like, oh, ABS-CBN announced this, and therefore ABS-CBN has to be corrected, say, or I'm not saying they did anything wrong right now, but I'm just using that as an example. But so that's the broadcast type of communication. The thing with gossip is that it's coming from various sources, diba? And then nagsaspread siya through social networks. Now, you think of social media and digital as like gossip in hyperdrive. If it's happening in a local community, medyo malilimit yon dun sa community na yon, diba? Pero because it is in hyperspace, in hypertext, in social media, that gossip is actually circulating wherever those people are. So ako, na may mga friends ako in London, in the US, those friends will be seeing that gossip, right? So para siyang ganon. If you're looking at there's Facebook. This is actually looking into what I was going to say already, but post on Facebook has a hyperlink at least, so you can flag that link, right? Pero when you're talking about chat rooms, that's a very problematic area because it's actually very difficult to track messages going through chat rooms. They're private channels. And because they're private channels, just as an example, there was this one time merong suicide, nag-stream siya, and it was a video that was circulated in chat rooms. My understanding from there was that they tried to stop yung video, but the video was re-uploaded by various people. So because it was re-uploaded, it was really hard to stop that from circulating. So they are testing various things on WhatsApp right now, and we've been pushing. Various fact checkers around the world have been pushing for more efforts along various along chats, along messaging apps. Paano pipigilan yun. So there's a role for that the platforms need to play here.
Thank you, Ms. Gemma. And I guess with that, we can already proceed to Ms. Gemma's presentation on status of disinformation today amidst this pandemic, especially on how political discourse is being done with a very polarized environment.
So I was asked to give an overview, and I'm gonna talk about like fighting. We call it the information disorder. So we're not just talking here about media in cyberspace. It's like several types of information maladies. So you have misinformation, which is really false claims or misleading content, and then you have the disinformation, which includes imposter content, manipulated content, fabricated content. I'll show you some samples of that later. And then what distinct intent to harm. I would not talk much about this. I suggest that you read this very interesting, very informative handbook that was produced by the UNESCO, which had inputs from various experts on this matter. So what has it done, this type of malady? It has resulted in real world harm, and one example I will give is the case of Myanmar, where harmful information, false claims about a particular set of people resulted in a genocide. So this is really why it's important to address this. And the UN has already acknowledged that there's a role platforms played in this thing. So what has Rappler been doing about it? I was asked to give examples on how to go about it, how to fight this from the perspective of what Rappler does. So Rappler is a news organization. We typically report news, but also explainers and ways to content that will seek to make concepts that are complex for people more easier to understand. So we do that by various things. Our stories, we have a lot of infographics on social media that we do this. But what we have started doing in the past years, which we have been doing from time to time before, is we've started really fact-checking claims on cyberspace, because there's quite a lot that's happening around cyberspace. And 2017, we became a verified signatory of the International Fact-Checking Network at Pointers, yung code of principles for fact-checkers. And then we became one of Facebook's third-party fact-check program partners in the Philippines. So I won't delve on so much on the methodology. We have these on the site. So as part of best practices, fact checkers disclose methodologies, and we disclose the process through which we do our fact checks, like by the process of by which we decide on what to fact check. So it's in the website. I invite you to look at it, and then we also have it posted on a Facebook group that we started for fact checkers and for teaching fact checking methodologies. What do we fact check? We prioritize statements by key public officials given their potential to translate to policy. This includes statements that contradict previous statements they made. We look at misleading statements by influential figures and personalities which could affect public discourse and potential harm to the public. This includes claims related to the pandemic or to the COVID-19 disease. And then we also look into claims that are circulated en masse in social media, which have the potential to influence public opinion or incite hate. These are just sample claims that we fact check. We look at public officials, as I mentioned. We see a lot of these viral hoaxes, deaths every now and then. We also look at stories that get recirculated again with the wrong context. So this is one example of it, where a story that was published, an old story by Rappler, was recirculated soon after the Davao bombing. And it was made to appear that this man was nabbed after the Davao bombing. coming, when in fact it wasn't true. So this story was recirculated by a number of hoax sites that are no longer online. It was shared to various groups and pages. We also look at imposter sites and pages and circulated on Facebook and on other social media. And then false quotes, you've seen this probably. False claims we also see in comments. I'm sure a lot of you have already seen this before. If you follow any of those hugot pages, it would be useful to examine what all other content that they see. So many pages in Facebook that amass following through these quotes, through this viral content that appear to be like very engaging and are universally accepted, but eventually like they're used to circulate false claims. And we've seen this this is a sample of that. We also see a lot of either misrepresented or manipulated images, and sometimes it's a real image, but it is presented in a different way. So this is one example of a grasshopper invasion supposedly that happened in the context of COVID outbreak, but actually this is not true. And then another one that got circulated after it was funny was that Russia was trying to get its citizens to obey quarantine procedures by releasing lions, which wasn't true. Some of them probably started out in satire sites, but they are then circulated as fact and people believe. We also see quite a lot of these claims that use false superlatives, and that is usually associated with like efforts to hype up a particular personality or like attack particular individuals or groups of people. As I mentioned earlier, chat rooms are becoming typical channel for circulating false claims. This is one of the false messages that was circulated in chats that we fact checked. It's about supposedly a raid, and it didn't happen. You can see the fact checks that were done on this on our website. So there you can just go to rappler.com/fact check for background on these false claims. And then in the context of COVID-19, people are at home, they have nothing to do. They shared quite a lot of things. And in fact, in relation to this subject matter, we fact-checked over 100 claims related to COVID-19. And global fact checkers, we've been working with other fact checkers from around the world, and thousands of fact checked content of claims have been fact checked, affecting I think millions of posts or related to millions of posts online. So quite a lot of rumors, false cures, false claims about vaccines, and all sorts of things are circulated. But also, one of the things that we noticed for the Philippines is there's also quite a lot of claims, false quotes, whatever, that was and political, what appears to be political false claims that were circulated around against critics or about government programs. So what do we do? What do we actually check? So hindi lahat na-fact check, and what we look at when we fact check really is if there are details that can be checked, and those are details that are verifiable, and which means it's possible to do a fact check. Otherwise, if it's a general thing, it's really more of an opinion rather than something that can be fact checked. So we steer clear of opinion unless they are based on claims that have verifiable details. What happens when when content is rated by third-party fact check partners of Facebook? So what Facebook says is that they reduce the circulation or the distribution of those links or content that have been flagged as false or misleading by their third-party fact-check partners. And then they have started doing this. You probably have seen this. There's an overlay for images. The problem with images is that even if you see a debunking claim, you retain the image in your head. And because of that, it's really important that you make a purposive decision to click it first. Before you make that decision to see the image, there's already a flag that says this is false or misleading. So this is already being done for things that we read. So it's important to report claims actually to fact-check partners of Facebook, because then those claims will be rated. At the same time, Facebook's algorithm also looks at similar content to content that have already flagged. And then the page that was posted that false claim, they are flagged. They can get their circulation reduced, and then at the same time, pwedeng the monetization options for that page can be revoked as a result of repeated flags. So hindi lang binabanggit ng Facebook kung how many times it takes for them to actually do that. But now, beyond just fact checking, because for us it's really problematic to be just looking at it at this the way information the information disorder just be addressed through just fact checking. What we do is we look at these we actually study the data and look at what Facebook now calls inauthentic coordinated behavior. So connected ito sa disinformation and propaganda. In this case, what you're looking at is a coordinated way through which information or messaging is circulated online. So para siyang, if you've heard of the term budol-budol, so you can say this is like online budol-budol, where you make it appear that there are multiple people sharing the same view, and therefore this must be correct. So that's an effort to so there's really an effort to mislead. We've seen this circulated around multiple groups in relation to claims about martial law and the Marcoses, and we're also seeing this in relation to red tagging on social media. So this is something that Rappler does and studies very carefully because it has a really significant impact on people's beliefs. Beyond fact checking, it's important to look at coordinated behavior, and we do that by looking at data, by examining data, and looking at also the messages that are being circulated in various channels and pages in Facebook. And what we look for is whether there is coordinated action. There appears to be a coordinated move to seed particular messages. And we've seen this in various things. One particular example really is the martial law and Marcos messaging, where this has been seeded to we've seen thousands of we've seen these messages, these false claims circulated to thousands of groups and pages in Facebook, and also to various channels in YouTube. Very mas alarming ito because this has an impact, really a significant impact on people's perceptions. And it's very very incessant. It's like it's repeated. The message is repeated over and over again. And the Nazis say na if you repeat a message like how many times, it becomes truth, and that's a problem. What we do is I'm not sure if you see this. We do webinars every now and then to teach the fact checking methodology. Mahabang usapin yung fact-checking methodology. So I suggest if you are interested in that, you may want to sign up for one of those webinars where we do both overviews and hands-on teaching people fact-checking. And then at the same time, we also do call-outs for people to false claims in Facebook so that we can see more of these and rate them. So that's all for now. I'm open to questions.
So we've talked about how disinformation is being circulated, how the design of social media channels also affect how disinformation is being distributed, but at the same time, how the press, how the free press, how citizen journalists can also help with fact checking, can also help with building a community to verify each other's what we see on our computer screens and our mobile phones. Thank you very much, Ms. Gemma. For those who are tuning in, we have a Q&A feature that you can send in your questions. I'm going to read the first one. How true are the so-called troll farms, and how much investment is required to make these manipulate people's opinions?
There's been a lot of reports about troll farms, and we think that's true. So we've also seen companies really, one of the biggest takedowns that Facebook has so far is a company in the Philippines, yung Twin Mark Media, and it was operating like numerous Facebook pages which had, I think, over millions of followers each. All of these pages, it's a lot of things. It's really, you look at it from several perspectives. You have the content producers, and then you have the engagement. Okay, so and both have been documented that there's really people producing all these false content and even false dubious sites, but also you have a lot of people also involved in inauthentic engagement. And here in the Philippines, it's actually easier kasi to just hire people, unfortunately, than automate things. And also easier naman for the platforms to go after automated action rather than yung mga taong gumagawa ng ganun. Kasi mas unpredictable yung tao ang gumagawa. Part of it is cheap labor, part of it is accessibility. Like it's really so easy to do it here. Very untraceable yung mga tao, so you can do it with impunity and so on.
In connection to that, Ms. Gemma, we've seen during the outbreak of the Cambridge Analytica scandal, where we learned that a lot of innocent Facebook quiz apps, for example, have illegally harvested data, and on how and the data that they get from that actually evolves into how social media users also interact with the data. So, what is public policy missing in terms of protecting people with their privacy, and at the same time letting them know that they're giving up these privacy rights when they get some seconds of entertainment on social media?
So you probably are aware of the face up thing. Keep on posting on my page that stop using that. Okay, I don't use face up or all these. You know the quizzes, di ba, na mukhang fun siya, pero the moment you allow it access to your data, then it can be used to target you. So ang critical dito is the targeting, yung the use of the data to target particular individuals and our vulnerabilities. Yun yung pinaka critical dito. It's like in a way it's actually parang it's military. In some of the studies around this, they have already called this a military tool. Hindi siya lang yung parang, because it's so precise. It's almost too precise. It's unlike when you're advertising where you're broadcasting to millions, so it's not targeted specifically to you. In this case, it is targeted specifically to you, and the problem is it's also not very visible. You're seeing you're different from mine, so it's very difficult to monitor what's happening. So part of the effort that needs to happen is about is in relation to transparency by these platforms on who is targeting who, things like that. A lot has to be done in relation to that, because then you know what are the messages that are being pushed to these people. So kasama yun sa mga kailangan mangyari, like really engaging the platforms, really pushing back at the platforms, because it is these tools that are being used. It's not enough. Ang worry ko about like legislating things is we know for a fact that the fake news provision in the Bayanihan Hill as One Act was used against private individuals who were just criticizing government for things that they found lacking. So it's a balance that we need to hit.
Thank you, Ms. Gemma. Dr. Robert, a question would also be, it seems like someone is profiting from all these disinformation. It's almost like a business model for different platforms or what. Amidst this global pandemic, there are, for example, a specific drug or a specific product that would help ease the pain of those who get the virus. Do we have maybe reports from the health industry or health field where this is being used in order to market? The disinformation infrastructure is being used to market a specific product, a specific drug?
For now, we're currently at the stage wherein we only know that there are vaccines, but I'm not quite sure if they're profiteering with misinformation about vaccines. But it's quite somewhat difficult at this point of time whether there are those that actually profit from health misinformation. That will be for research for the next decades. In fact, even up to now, there's still research about SARS in terms of health communication, because at this point, at the point of pandemic, research is mostly focused on how do we develop the cure, how do we develop the vaccine, and it would take time for us to realize the effects of health misinformation and to some extent political disinformation on health systems. That's why we would need journalists and researchers to actually retrospect these experiences in the years to come. So even journalists right now are overwhelmed with reporting what is true or not, and it would take to reflect all these things in a way that is systematic and that is something that we can communicate well to the people. So for now, quite difficult to say. I hope there is none, but I won't be surprised if there are people who would who would gain economic or political advantage from spreading health misinformation. But I would say that for now, people who are sharing spreading misleading information on miraculous cures or vaccines, it's just that they would want some glimmer of hope. Filipinos, there have been some studies that Asian societies are somewhat fatalistic. It means that when we think of diseases, we think that we're powerless to overcome this. And sometimes when there are some news about like miraculous cures, vaccines, sometimes there's this glimmer of hope. And even sometimes it's not verified or it's outright misleading. We actually share it because we don't want to just monopolize the news. We also want to share this news to other people. And that's how health misinformation spreads. So it's a network.
Thank you, Dr. Robert. So to our attendees, we're also accepting questions on health or political misinformation, since both questions will be addressed to both speakers already. But while we're on the topic of spreading health disinformation, Dr. Robert, someone asked if we have a study on how many people have actually died because of a particular health chismis. And I'd like to expand on that because, for example, before the pandemic, we have always had a cultural belief that what some of the symptoms or sickness are being caused by, for example, kulang, right? So how should our health institutions battle these cultural beliefs that sometimes prevent people from going to the hospital or seeking professional help? But then they go to maybe alternative centers and alternative traditions of getting cures or from their illnesses, especially in this time of a pandemic.
Based on what I learned on the healthcare system in the Philippines, people are not exposed to the healthcare services because the healthcare service is not accessible. Imagine if you need to go down the mountain for 2 hours just to receive medical attention or healthcare services. It would be difficult to curb some of the social beliefs or some of the cultural beliefs because they're less exposed to the healthcare system. So at the root of it is the accessibility of our healthcare system. The more that we can get people to be more exposed to our health system, the better. That's why we have the universal healthcare law. There is more about increasing primary healthcare. Primary, which is more health promotion and disease prevention, which means that you need to make sure that the health system is within reach for every community. And within that system, we can actually make more health promotion campaigns. And unfortunately, that is somewhat difficult in our situation right now because you need to establish more barangay health stations. Even our local government hospitals are not equipped with even manpower and the resources. So that's the problem that they have with the COVID-19, that our health system might collapse because our health system is already collapsing without the COVID-19. Much more if we have something like COVID-19. That is why I think the lesson here is that eventually if we want to reduce people's beliefs on certain social, on certain cultural beliefs, we need to make sure that the healthcare system is accessible to them. And I think eventually what COVID-19 teaches us is that health literacy is important. Strengthening the health system is very important. And hopefully, when our children, our youth are well educated, they're less likely to fall on health misinformation and any sort of political disinformation in the future.
Thank you very much, Dr. Robert. Question from our participant. In Brazil, they're seeing a problem with adherence to social distancing because there's a confusion because the president is saying one thing based on disinformation and governors and mayors are saying another thing. So are we seeing the same dynamic here in the Philippines where different levels of government are giving different advices and resulting in potentially dangerous actions that maybe one thing is being said in late night press cons and then another is being said in 4 p.m. Updates from the Department of... let's have Ms. Gemma for that.
Yeah, so this is really why. So you have authorities, right? And government is on authority. But this is really the reason why you need to like triangulate information. It's not enough to like base it off one source. In other times, really authorities in government, like public officials, also circulate false claims. And not specific to a particular like scientific claim here. One example that I would say is like yung who is covered by the social amelioration, yung emergency funds, 'di ba, that were circulated by government. Nagreklamo nun yung mga barangay officials kasi ang sinirculate ng isang ranking government official is that lahat, 'di ba? So ang kinalabasan sa ilalim, yung mga lahat ng barangay officials nagagalit sa kanila yung mga taong bayan kasi yung mga constituents nila because they were only given a limited number of forms, but people were told that all families will be given benefits. So those things, that's really one reason why it's important to triangulate information para lang to surface what is ano ba talaga yung totoo, right? It's not enough to really base it off just certain authorities because you also have to understand that in certain cases may mga also have interests to protect.
Thank you very much, Ms. Gemma. And I think that really poses a problem, especially when this information, because of the platform that's provided to these politicians, it gets shared not just through social media or through the press cons. It goes beyond to the community radio and to different channels. And then the clarification later in the day doesn't reach the same channels
Kasi
afterwards.
boring siya.
Mm-hmm.
So one thing about misinformation and disinformation, they tend to be novel, they tend to be, wonderful. So yung kaya nga siya na-share kasi sometimes it's as Dr. Bautista said, people see them as helpful information. But the other side of it is mukhang fantastic siya. So therefore, mas na-share siya kasi novel siya. Hindi siya kasing boring as like a scientific journal or even an article from a news organization that says something na, okay, that might be not palatable to people.
So one of the signs ng if fake news is, at least research, is that most would have messages that are emotionally arousing.
Yes. Mm-hmm.
So for me, I'm always somewhat skeptic if the headline or the content of that post would arouse your emotions to feel bad to another party or to another person or another group of people. So that's one of the hints that there's misinformation or even disinformation behind that. So sa mga viewers natin, pag makakabasa ho kayo ng somewhat yung bigla na lang kayo magagalit or bigla na lang makakaramdam kayo ng bugso ng damdamin kasi nabasa niyo na maraming namamatay ng mga bata dahil hindi nabibigyan ng bakuna at kailangan ng bakuna na to. Kailangan po natin mag-isip ng 4 na beses na bago ho i-share yung mga ganito. Kasi malamang sa malamang ho, ito po ay hindi po totoo.
So it's more than just double checking now. We really have to quadruple check, ensure that other news organizations are also reporting about it, that we don't just rely on one source of information, maybe from our friends or maybe even just one maybe popular Facebook page, but we really have to quadruple check with a lot of sources.
Unfortunately,
yes.
Quadruple checking is masakit siya sa ulo. Sa English, it's cognitively tasking to do.
Yeah.
Yes.
Mm-mm.
So that's why you couldn't even, di mo rin masisi yung mga tao, but sila nahuhulog sa misinformation or disinformation kasi medyo nakakapagod din mag-search, and given the digital divide sa Pilipinas, not everyone would have access to the internet, and even some people fall into traps because they only read the headline but not the entire article because they only have like free mobile data on Facebook, and they couldn't access the entire article because they have these constraints in accessing the internet. So those are some of the social realities that we have in terms of information seeking. So verifying news is cognitively tasking and would actually show some in terms of access, yung accessibility natin sa information.
Thank you, Dr. Robert. It really seems like it's also the design of the platforms, because it's so much easier to just hit the share button rather than just going to another tab and then checking if 3 other news sites are talking about it in order to quadruple check.
Pero idagdag ko lang Justin,
Yes.
na it's really very important that we become comfortable with this already. Yung the art of double checking and triple checking and having multiple sources of information and re-scrutinizing our sources of information. Kasi we were used before to that realm where we have textbooks, 'di ba? Na yung textbook yun na yung Biblia. But actually, even in the study of history, yun yung isang problema when you're relying only on one source, you don't develop that capacity to criticize and to critique yung source. So, this goes beyond it, but it's really about how we teach our kids learning and we really need, fundamentally beyond learning facts, we need to learn how to scrutinize and be more critical.
Thank you, Ms. Gemma. So media literacy is very important for people to understand the different dynamics of how information is processed, how it's shared, and maybe the different features that they can also use in order to share to their friends what is real and what is not. When it comes, someone sharing on the chat, when it comes to health matters, what we don't know can actually kill us. That's very true.
Yeah, precisely.
There's an interesting question here on the Q&A box related to the legislation that was passed on emergency powers law. No, that it was. The question is, how do we balance people's right to free expression and the issue of spreading disinformation? Again, on legislating and measures that would curb the spread of fake news, but at the same time ensuring that it doesn't become weaponized to silence dissent, because the wording of the law, the provision on the Bayanihan Act was anything that would cause chaos or panic or anarchy among the people. And yet, it seems like private individuals are bearing the brunt of the charges on the law, rather than more public personalities, public officials, who are getting charged for spreading disinformation. How do we balance that?
So there's a problem if it's actually, this is something, the question on whether this is something that government should be the one making decisions on is something that we have already discussed even in like previous fake news hearings in the Senate. Because your problem is, well, to begin with, right now, from our studies of the of the trolling on social media, you actually have a situation here where you have a lot of false claims being circulated on social media in favor of government, but government is not doing about it. Like the NBI is not doing anything about it. They're using the president's name. They're using and there's nothing being done about it. So parang you have a problem there if it is just government looking at it. In our constitution, actually, this is why diba, yung there's that provision called yung sa press freedom provisions ng constitution natin. There's really that element where it's saying that you cannot legislate anything that hinders that right to freedom of the press. So in fact, the press is self-regulating precisely because of that. So it's more on mechanisms that are around that need to be enforced, like how does the press police its ranks, and then how do the public also pitch in. How do you show trust in a way that it's not parang tribo lang tayo, but also looking at what is the background, ano na yung mga previous na reports nitong mga news organizations na to. It's a complicated process. Hindi siya madadala sa like isang bagsakan lang. But what we know is that right now, with the fake news provision, the times when that fake news provision of the Bayanihan to Heal as One has been invoked, it has been invoked to address critics. And the critics were all basically just complaining about services.
Thank you, Miss Gemma, it appears these aren't even the usual people from the political opposition. These are, for example, teachers or recipients of SAP who, in some reports, have only asked a question on their LGU's Facebook page, and the next thing they know, they're being accosted for asking that question. So it's really alarming as to how people cannot properly react even to something that they're entitled to.
What you don't want is that chilling effect. So yung isang very very important na decision ng US Supreme Court in relation to press freedom, for instance, has to do with the press being rendered free to criticize, and that's very critical to democracies. And the moment you start looking at having government regulate that, you start having a scenario where there's a chilling effect. Matatakot na yung taong, matatakot na yung mga journalists to actually criticize because pwedeng nangyari to.
Thank you, Ms. Gemma. There's a question for Dr. Robert on the chat. Because Dr. Robert, you're in the unique position that you're exposed to the news happenings in the United States and in the Philippines. Which country has it worse when it comes to health disinformation, the Philippines or the United States?
Okay. First is that I would say that political polarization is a much different scale here in the US. Next is that it really depends on which TV channel are you watching. There have been studies that if you're watching from Fox News or any that is somewhat aligned with the government, then you're more likely exposed with disinformation. There are studies that would say something like that, and those that are not viewers of that kind of TV station would be less susceptible to misinformation. So it's quite difficult to compare it in the Philippines without any formal studies. It's even for me, I have no direct answer for this. Especially that in the Philippines, we just lost one network, at least in the mass media. So especially this time of COVID-19. So where do people get their information? At least it's being supplemented by social media. So to answer this question, which has it worse? Both countries would have their own problems, unique set of problems, and we need researchers. I mean, definitely there will be research studies for the next 10 years that would answer this question here in the US. I'm not quite sure in the Philippines if we will even have research funding to do this kind of research. I hope there will be. There are people who would be interested to answer this kind of question, but eventually this kind of questions would need research funding, and to any research in the Philippines, funding is really a problem. So we hope that at least it's not only the health system infrastructure, but in terms of research funding in the future. The only way we can answer this is by doing formal research within the next couple of years.
Thank you, Dr. Robert. We're seeing very alarming reports of, for example, President Trump holding huge political rallies, and most of their attendees are not even wearing face masks that go against public health protocols that are being shared by...
That's why there were some academics, especially in the communication field, that they actually wrote open letter saying that please don't televise Trump's updates.
Mm-hmm.
Because sometimes they would contain disinformation, it would confuse the public, and it would make things worse for some of the people, to the point that sometimes Dr. Fauci, which is the head of the NIH, would somewhat need to make some corrections along the way, and there were some problems with their relationship right now. So Dr. Fauci is more of the science person, the health person, and he has a obligation to actually tell what is the current best available evidence that science would offer. So one good example for that is the chloroquine issue in the US.
So, or ingesting bleach, for example.
Yeah. So those are some of the things that's why there's some academics that would have some opinion that please don't televise Trump's daily briefings about COVID-19, because people learn some information that may contrast what health authorities would want people to know.
That's an interestingly challenging concept, turning your back against a public official, no, who are supposed to be your source. So maybe Miss Gemma, can you share? Because, for example, the media would have to
Yeah.
attend these different press corps and different press cons and build relationships as well
Mm-mm.
with sources.
This is actually challenging, and this is something that is a constant conversation among journalists, among people who people who are also monitoring or covering the press. Kasi on one hand, you have a public official who is accountable, and therefore you have to cover that person. Like you have to
Mm.
really report on what that person says because accountable official siya. But on the other hand, yes, because of that power, because nasa position of power siya, natatend the tendency is for media covering that to yung amplify precisely yung false claim. So this is actually the reason why within media you will see the trend already where as the false claim is like there's effort already to do real time fact checking, because on one hand or even like labeling claims which are said by these officials is important kasi like you cannot also not report because
Yeah.
the fact alone that that person said this is something that the public should know and therefore should influence the decision of the public on whether to re-elect that person, lalo na kung elective official siya, re-elect that person or not. So it's really a very delicate balancing, and what we try to do there is to label, to flag those things and then give context. And what's important is you do not air it without context. You do not air a false claim without context. Of course, it means that by doing that, you also invite the ire of people who support that person. And that's happening right now with the fact checkers.
Yes, because sometimes it's very alarming how even the most outrageous disinformation is being shared and being declared by these public officials that you don't even have to be an expert in that field to know that it's a blatant lie. But my question would be, what does the media think on the effective way to fact check, for example, a statement from a public official that is a lie or a blatant lie? Like, for example, is it more effective to write about the story and then come out with a statement, or do you fact check on the story itself?
So there's a difference between reportage or just like plain he said she said reporting, but also there's that what is being pushed by a lot of journalists around the world is to really provide context on the story, on the first story itself. It's very important to do that because you may not see the debunking article as we have already discussed here. Typically, debunking articles are not really like do not really get that much circulation. There are efforts by platforms to surface those debunking articles, but that's not enough. And what you want to do to begin with is to call it out as soon as it is said. And like one of the efforts that came out recently, for instance, Facebook has started, Twitter has started even labeling Trump's, in providing context to Trump's tweets, right? That's that's a very controversial move on the part of Twitter, particularly since there's a U.S. company and this is the U.S. president, right? But it is critical. So even in the past, di ba, yung when it was not, social media wasn't there, not everybody can actually just go to a particular news organization and speak out, di ba? Just because you have freedom of speech, we have freedom of speech, doesn't mean that everybody can actually have a platform, di ba? There's still that gatekeeping role that happens on the part of the dati non editorial yan, yung production team ng ng newsrooms, yung editorial teams ng mga newsrooms, sila yung dating gatekeep, and they were supposed to be providing context or contextualizing those statements as they write those stories. That's really journalism. Journalism is not about just acting like a chronicler. You're supposed to give context also when context is needed. But ang nangyayari, ang thing with social media is because it's so like on the fly, di ba? Like oftentimes real time siya, ganun. And then public officials already have their own respective platforms. They have their own pages. Yun yung tendency is you have that yung parang you usually have a situation where the claim is not that it is circulated in a way that it is not accompanied by debunking complaint or content that contextualizes it. So, for instance, a post that is posted by somebody on Twitter or on Facebook, because it was not contextualized, it is accepted then as truth. So that is what the fact-checking process is about. It's not stopping, and just to be clear about it, your post does not get deleted automatically just because it was flagged as false. It is just the reach is just reduced, and then it is just accompanied by that story. So just want to be clear about it. So that is meant to then contextualize the post. So very important yung context. Very important to show na, hey, sinabi niya to, yes, pero, and totoo na sinabi niya to, di ba? Pero, it is not true. Yung sinabi niya na yan ay hindi totoo. And here is the context.
Thank you, Ms. Gemma. Amidst this pandemic, how can public health experts and the media collaborate in ensuring that relevant information is being shared across all platforms, reaching across different geographical and socioeconomic variations, and also translating and laymanizing public health terms for people to understand better. Dr. Robert or Ms. Gemma can go first.
Baka gusto mo na si
Dr. Robert.
In terms of sa language, bigyan kayo ng example. Yung salitang ugat, it can mean nerve, arteries, or vein. So, pag tinagalog mo yung artery, ugat yun. Pag tinagalog mo yung nerve, ugat pa rin yun. So, there's some inherent words in the Filipino language that's quite difficult to translate. So yung virus, sometimes it can be misconstrued as a bacteria. That's why people think that if they have flu, they could take azithromycin or a very famous self-medicated antibiotic in the Philippines. So going back there, I think one of the ways is to actually, I would say that here in the US, they have a very good health communications department. They would have this for each of the branches of NIH. There's this health communication department, and there's this overall health communications department, which is part of the health promotion departments here. In DOH, I think it's not really that a big group. So one of the people that is part of that is Dr. Beverly Ho. So we usually, sometimes we actually see her during the DOH virtual pressers. And I hope that in the future, DOH would actually increase the budget of the communications department, and hope that the communications department would have much better close ties with the media outlets, so that they would have fast dissemination of accurate results. But even in the, I think one of the problems they had sometimes is that sometimes the need to immediately convey information, they would have some lapses. Like for example, the famous bar chart that they had, wherein the bar chart was not consistent with the number. So I think that there was this bar chart wherein the length of the bar chart does not correspond to the actual figure. So sometimes there have been some lapses, but I hope that those kind of things serve as a lesson on how health communications department within our DOH would be improved in the future, especially during this COVID-19.
So, I'll give you an example of when it worked. Okay, kasi in the past, what we did actually was, what government did actually for in relation to crisis was that it tried to treat media as partner also in communicating information related to risk, and that is actually very important. So, kasi when you see media as a partner, you're seeing media as a way, as the role of media to circulate information that in various ways. There's that plurality is important, ha, kasi iba-iba yung audiences nitong different media groups na to. So that it's important to be able to communicate, to have these information circulated in as many platforms as possible, or as many news organizations, by as many news organizations as possible. There's that, pero there's an expectation kasi on the part naman of government that by doing that, media should not then be critical of what it does. So parang may ganung klaseng problem na when you then report on the negative things, that means you are not being helpful. And the health department and other branches of government need to understand that just because there's critical reporting, it doesn't mean that media cannot be a partner. That is important. Critical reporting is important to governance, to holding particular personalities, particular agencies in government accountable for things that are not done, for abuses, etc. That is important, and that has a role to play in democratic societies, and in the proper functioning of government itself. But on the other hand, part of that reporting is yung also giving information, like giving access to information that is needed so that media in a more structured and helpful way. I think a big part of the problem, like in relation to this, is also the communication, like even the release of the data. Ang daming naging errors in the release of the data, or sometimes the data is not enough, not hindi malinaw, mga ganon. So when that happens, then you compound the problem, that you make it difficult for media then to report in a correct way, 'di ba? Kasi to begin with, the data that was shared was already lacking, 'di ba? Or not clear enough. And yun yung isang nagiging punot dulo ng misinformation. Not intended, pero nangyayari na misinform yung tao because the information is not enough. So parang I think it's important. It is really important government to see that it needs to have a healthy relationship with the press, and that healthy relationship is not contingent on good press. That's PR. The media is there both to amplify important messages, but also to hold the powerful account. And that kind of balance is there. They have to understand that.
Thank you, Ms. Gemma. That's an important note, no? Because some would appeal that, media shouldn't be as critical because we need to build public confidence among institutions. And if you report critically, then maybe people won't trust our institutions. But the truth is that media can't just report the information given to them at face value. They also have to be critical. They have to go deeper. They have to ask, where is this coming from, for example, or how is it being used? So with that, we thank our panelists for joining us this morning in order for us to know more about the situation of political and health disinformation amidst this global health crisis that we are all facing right now. Maybe for last statements, because our viewers come from different local governments, come from overseas Filipinos. We have audiences from the youth. What should be the next step in their individual and in their capacity in their community in order to ensure that we can curb political and health disinformation amidst this global crisis. Let's have Ms. Gemma first.
Okay, so as I mentioned, it's very important that we promote critical thinking. Yun talaga yung punot dulo ng lahat. Critical thinking is important because you're not just dealing with a pandemic. You are dealing basically with a situation where information is now you're in an age of information plenty, and therefore you need to be able to sift through the information that you're seeing and discern, di ba? Be more discerning and more critical. So napaka-importante nun. The other part of it is really like making sure that you need to understand criticism is it's not fake news. Criticism is a necessary part of a democracy. It's part of the proper functioning of governments and democracies. So that's very important. And to do that, to safeguard that, you cannot have government just be the one to dictate what is false and what is not. The plurality of media is part of that whole requirements to have that for that check and balance to happen. Now, the other part that I always stress here is the role of the platforms. The platforms have a big role to play here. We need to understand how this system is working. Kasi kung hindi naman to problema, kung nung panahon kung ano lang to, 'di ba? It's limited to a particular community. It wouldn't have this big of an impact if it is just limited to a certain group of people. The reason why this has a global impact right now is because this is the first time in the history of mankind when we have over 2 billion people connected. 2 billion of 7, almost 8 billion people are now connected through a single fabric. That's social media, diba? And therefore, the platforms need to then examine how this information is spreading and how do you address that. Because basically, when you removed, when you gave everybody the power to have their own platforms, you then need to find a way to police that platform or to at least moderate that platform. It's essential to public discourse.
Thank you, Ms. Gemma. Dr. Robert.
So we're in the middle of a pandemic, and we're also in the middle of an infodemic, as what the United Nations is saying. So we need to be careful with what information we share. It's not what we receive, it's about what we share. We can actually limit health misinformation if we think 4 times before sharing it. We need to play our part into actually mitigating its spread. We need to report posts that contain health misinformation so that the social correction would facilitate algorithmic correction. So algorithmic correction is the one that social media platforms use to automate some of the ways that this post is misleading and other things. So we as citizens would have a role to play as social media users, and yes, it's true, we're in a single social fabric within social media. That's why any information that we share, we might be held accountable to that, and we need to be somewhat responsible and be able to justify what we share. So for our viewers out there, if you share information, make sure that you can justify it, because people can screenshot it, and lalo na sa Pilipinas ngayon, pwede ka siraan kung people can actually target you for that. But as long as you know that you have the basis for what you're sharing, you have nothing to fear about. it. So we need to make people somewhat also realize that sharing information has its responsibility. We have a responsibility to share correct information. And aside from that, we also have the responsibility, not really a strong responsibility, but we would want to urge people to actually play their role in reporting health misleading posts so that we can limit the spread of health misinformation. Salamat po.
Thank you, Dr. Robert. So being critical, being discerning, asking our platforms to do better, and at the same time being accountable to what you share. Thank you very much, Doc Robert and Miss Gemma. And thank you as well to our viewers and our attendees. We will be giving out the presentation to those who have signed up to our webinar as well through Zoom. And so we can continue the discussion after this. Thank you. Maraming
Thank you.
salamat.